So today I'm going to talk about migraines and hormones, and if you're wondering if they're related, they definitely are. So, which specific hormones influence migraine? These are usually ovarian hormones, so estrogen, progesterone, testosterone. Estrogen is the one with the most research and most likely to influence migraine, and their estrogen and progesterone do affect other neurotransmitters in the brain that affect migraine. So serotonin, glutamate, noradrenaline, GABA, and even opiate receptors. So that's probably one of the mechanisms on how or these hormones influence migraine. And if you're wondering if these hormones are in the brain, they are. Um, and estrogen specifically, the decline and rise, uh, so and fall in estrogen levels can trigger migraine. Um, so there's mouse studies that show that with the rise and fall of estrogen levels, there's enhanced sensitivity of neurons within the trigeminal nucleus caudalis. So that is located deep within the brain, and it's considered to be one of the key areas of the brain that's associated with migraine. So with these fluctuations in estrogen, the neurons in this area of the brain become more and more sensitive. Um, Also, high levels of estrogen can induce um, migraine with aura, and high levels of estrogen also increases the risk of blood clots. So in pregnancy, this is what happens with high levels of estrogen. So later in as pregnancy goes on, levels of estrogen keep increasing, and that's why sometimes people's headaches will get better at the end of pregnancy. Um, and then CGRP, which is one of the molecules that's known to be associated with migraine, these levels are kind of fluctuate with estrogen. So as levels of estrogen fluctuate, so do CGRP levels, and that might be another mechanism of how estrogen and migraine are related. Progesterone is a little bit less studied in migraine, and its role is less clear. However, they have noted that people with migraine tend to have lower levels of progesterone derivatives in some studies. Progesterone itself helps decrease neuronal excitability by increasing inhibitory neurotransmitters like GABA. Um, but they've noticed that people with menstrual migraine can continue to have headache even if they're given progesterone pills. So that's why the role is not very clear with progesterone. And then even less studied is testosterone. There's very limited studies. There was one small study that showed that men with chronic migraine had lower testosterone. Another small study showed an improvement of menstrual migraine with Danzol, which is an androgen similar to testosterone. There's not really any clear conclusions of how testosterone specifically affects migraine. And so migraine really fluctuates throughout one's life. So as many of you probably already know, migraine is way more common in women, and that's likely because of all these hormones that are higher in women and the fluctuations of these hormones with women. So prevalence of migraine before puberty is the same between girls and boys, but becomes way more prevalent in adolescent girls and stays that way in women once they've gotten their period. Migraine does improve with pregnancy, later in pregnancy as the levels of estrogen continue to rise. And I did mention that before. And then after the baby is delivered, headaches tend to get worse, and that's related to changes in estrogen. If someone breastfeeds after delivering, they might not have as much migraine because the hormones are a little bit more steady and don't fall off as quickly if someone breastfeeds. So that might mitigate some of that postpartum headache. Also, there's worsening of migraine around menopause because hormones are fluctuating even more, and people have longer periods of lower estrogen and lower progesterone. They might have periods that last more than their usual period. So that's why a lot of people will have worsening of migraine when they're around menopause. And then after menopause, once hormones have kind of stabilized, people tend to have improvement in migraines. And these changes are mostly related to estrogen. And so this is just a picture of what hormones do during the menstrual cycle. So if you look on the left side of the screen, that is day one of a cycle, and that's when the period occurs. So the first day of the cycle is the first day of the period. And you can see just by looking at this chart that all the hormones are low. So progesterone is low and estrogen is low. Those are the lighter and darker blues. And then also there's this peak kind of in both of these hormones around ovulation. And so some people actually get headache around ovulation, and that might be related to this steep increase and then decrease of those hormones, which you can also see on this graph, specifically with estrogen. Progesterone seems to increase later in the cycle. And so menstrual migraine is a phenomenon that's very clearly noted in the headache world. And there's actually a tool which headache physicians use called the International Classification of Headache Disorders. And this clearly outlines the definition of menstrual migraine. So pure menstrual migraine is headache that occurs, or migraine that occurs exclusively on day one, plus or minus 2 days of the menstruation cycle, and at least 2 out of 3 menstrual cycles, and at no other times of the cycle. So this is someone who only gets migraine around their period. And then menstrually related migraine is basically the same thing, but these people also get migraine at other times during the cycle. So these definitions are really to help us understand, are the person's headaches very closely related to these changes in the hormones. And studies have shown that people with menstrual migraine have more intense, prolonged, and debilitating headaches around this time. They're less responsive to treatment and have higher likelihood of having accompanied associated symptoms like sensitivity to light, sensitivity to noise, nausea. And in practice, we often use something called mini prevention around the menstrual cycle to try to prevent these headaches. So you can ask your doctor about that if you have headaches that are very clearly related to your cycle. And so the question kind of becomes, okay, so this is all related to hormones, so can I just take hormones for my headaches? And unfortunately, the answer is not that clear cut. There's no clear evidence that using hormonal treatments in migraine is going to get rid of the headaches. And oftentimes, hormonal medications can actually induce headache. And in one study, they noted that 1 out of 2 women with migraine reported no changes of the headache after taking hormones, and then 15% did experience improvement, and 28% of people had worsening of their headaches. So the data is not that clear on whether or not hormones would actually help. If someone is to take birth control, we often will recommend avoiding estrogen, or in patients who are postmenopausal, because it can increase the risk of stroke, and especially with migraine with aura, because patients with migraine with aura already have a 2 times higher risk of stroke, and that risk is increased with estrogen. If someone really needs to be on estrogen, it's important to consider the aura frequency and the dose of estrogen that they will be on, for a more tailored approach. Also, other risk factors for stroke, including age and high blood pressure, diabetes, cholesterol, those types of things. And then in terms of testosterone, that taking that hormone can cause secondary polycythemia, which means it can cause elevated red blood cells, which in itself can cause headache, and also blood clots. Progesterone, only medications are usually recommended for birth control if someone with migraine with aura needs birth control, or non-hormonal forms of birth control. And with progesterone, sometimes headaches can get worse at the beginning, but then seem to level out afterwards.